I've been in the state senate for 15 years. I've been on appropriations that long. So I'm just happy to do what I can to help you. Yeah, push so the green's on.
Okay, okay, I'm sorry. My name is Carrie Rowden. I'm the Executive Director for the Nursing Home Administrator Board. This is our Vice Chair, Chad Blackard, and this is Denise DeRosso with Cornerstone, who worked on our budget. I just wanted to tell you a little bit about what we do since you've never had the Nursing Home Administrator Board. We have about 450 licensees. So back in 1970, the federal government mandated that all nursing homes must have a licensed nursing home administrator to run the nursing home. So at that time, boards formed in all 51 states because they have the District of Columbia as well. To become a nursing home administrator, there's several ways you can come. You can come with what they call the Administrator and Training Program, or the AIT program, which is a 6-month internship that they do under the direction of a preceptor. We do have a preceptor certification course that we do annually. We have about 80 each year, and it's for a two-year term. So we have about 160, little over that, preceptors currently, and we keep that amount. But they precept, it's a 6-month program. Then they have to take a state exam that the board works with the Department of Health to write, and with our board educator, a member of our board. And then they take a national exam, which all the states do a national exam with our national association that forms. You can also come through endorsement or UROLA or reciprocity. And then you would just, if you're licensed in another state, you would just have to take the state test because you've already taken the other stuff. The board is 7 members. We have 3 nursing home administrators on the board from the 3 districts. And then we have an educator, a hospital administrator, a physician, thank you, and a nurse on the board. Am I forgetting anything? And then we meet at least quarterly if we have special call meetings, such as for a hearing or we need to vote for something, then we have a special call meeting. But normally we have, we're set for quarterly meetings. Thank you. We have 2 employees, myself, and I have an assistant. I've been with the board a little over 21 years. My assistant's been here about 3 years, a little over 3 years. And we currently have 3 board members that are up for a reappointment right now.
I want to interject here. I think it's timely that we're sitting down with the nursing home administrators with the ice storm that's going on in North Mississippi. And I guess my question is, do you know of any nursing homes that are out of power that still do not have a generator or water? Because we need to know, and we need to get some help to them. We have helped through some constituents' concerns that have caused some of the legislators, but if you all, in the position that you're in, if you don't have some kind of communication guidelines for your nursing homes, because we don't need to be hearing it from all over the state. If y'all can get some kind of communication guidelines to have your nursing homes report directly to y'all when they have an issue like that, no power, no water, no generator, then you can communicate it to, us, the governor's office, MEMA, somebody. I think we just need to get some kind of chain, with inclement weather, storms and stuff, to help our nursing homes. And I don't know if y'all talk about that or if it's something y'all have ever addressed, but I just wanted to bring that up.
So typically at the facility level, they communicate directly with the State Department of Health.
Okay.
Prior to the storm, the State Department of Health sent out an Excel spreadsheet for all the facilities that if there were an emergency to contact them, as well as their state emergency planner.
Okay. Okay, well, I appreciate that. I don't think some of the people got the memo because they were calling us, saying, I'm just saying that, like, we kind of intervened in some of the cases to try to, direct and help. But I appreciate the fact that they do have a plan set up to do that. And the fact that, I don't know if they're maintaining and checking their generators if they have them, but I mean, I think we need to make sure that they all have them to begin with.
Every facility in the state has a generator of some sort.
Yeah.
Depends on the size of the actual
Yeah,
generator.
yeah,
They don't run the entire facility operations.
right.
However, they do run at minimum the emergency plugs,
Mm.
main corridors, just depending on the size of the generator.
And the problem that happens is every time you need them, they go down and don't work because, maybe they hadn't been exercised or checked or serviced or whatever. But anyway, I'm gonna let y'all go on with your budget. This is a relatively small budget to what we normally see for a lot of these agencies, special fund agencies. So I'm gonna let you go ahead and continue to tell us what you would like us to do with your budget.
I just wanted to also say that we do not license the nursing homes, the reason why they go to the Department of Health.
Yeah, I realize.
Yes,
I
so,
I just.
if I hear of anything, I definitely will let you know.
Thing, let us, know, 'cause sometimes that
will.
stuff falls through the cracks and, we don't want to take, I'm certainly not pointing fingers at anybody because we all got to pitch in and help, but I just, wanted to make certain that they all knew what they were supposed to do when they get in a situation like that.
And I believe, Chad can talk more, but they had meetings regularly, call meetings with the Department of Health and the associations. And they normally have meetings once a week or once.
And they sent out, in
Yeah.
this storm, they sent out daily updates
Yeah.
from the
Okay.
National Weather Service. So, our company represents 22 facilities in the state. We felt like we were prepared as best we could.
Yeah. Okay. Well, I appreciate that. I just wanted to touch on that because I do know that we had one in, Tippah County that was out for a good little while.
So you mentioned that this is a very small budget, and I'm going to just talk about their needs from a financial point of view. I wanted to let you know that this agency very rarely comes before you asking for an increase in their FY25 and their FY26 budget request. They asked for level funding. And so you see that most often from this agency. But in FY27, they did have a small request. They would like to have a salary increase. If they can get progressions, what they would like to do is do it based on longevity and experience and performance, and so that they would not ask for it to be like an across the board.
So when is the last time there was a salary increase? How long have y'all been stuck in that salary range?
Give me a second. I think they were able to, there was no progression funded last year. However, they had a little bit of extra in their salary target. So they were able to give a really small increase last year. And so the last salary they both got was in September.
Only 2 employees.
That's 2 employees. That's correct. And if you look at what the State Personnel Board recommends for like the executive director position, she is well below what is recommended, almost like 30%. And so they're not asking for much. I think they're asking for like 3%. I'm so sorry. I'm so sorry. So they're not asking for much. The last salary increase they received, they did have enough leeway in their salary target. So both of the employees did get a pay raise in September of last year. They're asking for a 3% increase for the executive director and a 2% for the staff member. And if you look at what the State Personnel Board projects for the executive director, I've got the number if you need me to pull it out, but it's like $30,000 less than what Carrie's actually making. And a 3% doesn't even get her close to that. But part of the reason they don't want it, they want to keep it where it is with just a 3% increase. And part of that is the way their revenue works. They want to make sure that they have plenty of cash on hand and be able to sustain whatever projection that is going to be increased on the person.
You don't foresee any other big expenses coming up that you would need to?
The only other one that we have has to do with House Bill 1491 that was passed last year, and that's to move all of the data up to the cloud. And so ITS has given them an estimate of what that would cost. And so that estimate was a one-time fee of $3,000 to migrate the data, and then an annual increase of $2,546. And so they needed that. Now, my understanding is there is some consideration um, at the legislature to not have that funded by each individual agency, but just giving ITS the funding. So if that happens, then that would come out of their request.
Do any members have any questions?
Yes, sir,
Central-
we do. We have myself, the executive director, and then we have a customer service is newly formed customer service representative 3. And she's been with me about 3 years. She helps with licensing and anything that the board needs.
And you have how many years?
I've been with the board, August will be 22 years.
Oh, okay, thank you.
Anybody else have a question? Well, I guess that's it, if that's all y'all need, and I think y'all have presented just some simple things that y'all need done, and we'll do the best that we can to help you.
We appreciate it.
Mhm.
Thank you.
And we hope we don't have any more ice storms anytime soon. Thank y'all.
Thank you, Madam Chair. Want to keep it real simple. Uh, Y'all know for the last 3 years, we have been working to improve our efficiencies, especially at the county health department level with our reorganization. That has been very successful in terms of reducing our overhead statewide and also improving our ability to provide clinical services. We have steadily, the last 3 years, been requesting our fees to be appropriately adjusted to eliminate deficits in program areas that should be fee-based. That work, the county health department work has reduced our spending by $10 million in that area. A lot of that was federal money, but still reduced $10 million a year in spending on the county health departments. The adjustments and fees have accounted for a swing, including the request this year for 2 of our fees that need adjusting. That'll be a swing of about $8 million of general funds that will be relieved from programmatic deficits that we can pivot to other high need areas, and just working to reduce our overhead overall. Our workforce is smaller intentionally, and so our request this year is level funding, and that's also in the face of inflationary costs steadily going up for us as being part of healthcare. Our inflationary rate, for clinical services runs about 10%, so significantly above the normal rate of inflation of 2.5%. But we can absorb those costs for another year. I do want to let y'all know are likely 70 to 80% likely to be facing another federal shutdown the end of this month, which are very expensive for us, but we're prepared to absorb those costs as well. Our federal funding, which is the majority of our funding, is appears to be okay, but still unstable. And we have factored all of that in. We were prepared for a 30% federal cut in our budget. And still, with the improvements that we've been making the last 3 years, I'm confident that we can absorb the costs that we need. When we talk about cuts in federal funding, what impacts the agency operations relates to our indirect. So when you hear that we lose 30% of our federal funds, that doesn't all go to the bottom line. So, and also last year, y'all were very kind to enact the Public Health Trust for us, which is an endowment for public health that is designed to generate funding, a blend of private and public sector funding dedicated to public health programs, not to run the agency, but to help through the direction of the Board of Health and the legislature support some of our programmatic funding where we need help. We have some requests related to that. But in terms of the agency appropriation, we're asking for level funding basically because we have been able to reduce our overall state expenditure significantly. And I think for another year, we can absorb some of the impact to our budget.
Well, you and I have talked for many, many years about rebuilding the health department and how critically that is to the county health departments. And I figured all along it would be a cost saver because when we tried to shift all that to primary care, it didn't work. So I'm happy to see that they're being stood back up and the services are there in the counties where the people need them.
Yeah.
And of course, Elbow has a slight decrease in the budget, but we'll see how all that shakes out once we get down to actually doing a budget. And hopefully the shutdown won't be as long as it was last time.
We don't think it will.
But,
and it won't involve WIC this time.
and we're also working on that maternal and fetal care and all the other things that you've been doing. And I've been working with the Mississippi Healthcare Alliance on that. So, that's in the forefront of getting that care plan done, to address some of the concerns that you have. That we have across the state with that, to basically integrate all that together. I do have one question that I have to ask. Have we gotten a handle on some of this grant stuff, that we got such bad publicity over? And most of that was for you.
Yes, ma'am.
Took the reins, but I just want to know that we have the oversight there that we need now for
We do.
what was taking place.
And I was never so proud to have a peer evaluation in my life as for peer to have worked with us looking at what we have done. It really came down to one programmatic area that kind of ballooned with the mass federal funding during the pandemic. And we had identified that ourselves and had self-reported a good bit of that, and had been working ourselves to get our arms around better accountability for our federal subgrant compliance. We were not happy at all. And to answer your question, I would direct you to the peer report.
I read it.
And basically,
I just want to acknowledge it.
thank you. Yes, ma'am. Our expectation is based off our adoption of OpenGov as a technological support for compliance, that we will be demonstrating how to do federal grant compliance in state government. That this will be really the gold standard, because we have gone from what was identified 3 and 4 years ago as horrible oversight to now very aggressive oversight. And I was so proud. I had one of our partners reach out to brag on our new system. The folks that do it right with us love it. So that I appreciate you bringing that up, because we have been working very hard, and I'm very proud of the improvement. We're not finished, but we're very pleased.
Transparency is always the key. And unfortunately, we have bad actors all over the state, not just, with grants that come through our state agencies, but, local government. We see it all the time. So we just have to be cognizant of that.
Absolutely.
You know, unfortunately, we got to watch people like a hawk, you know, like that hawk's watching the chicken house. Um, so I appreciate everything that you've done on that.
Thank you.
And you know, our door is always open, even when you're not sitting in here in this meeting, to bring your budget forth to anything that may come up, you know, and I know you and I text back and forth on issues, but
Yes, ma'am.
anything that comes up that you need to bring to us or to Corbin, you know, whomever you can get a hold of, Briggs, you know, we'll do whatever we can to try to streamline your job. And it's a big job. You got a lot of tasks on that health department. So is there anything else that you?
And also, you know, from our standpoint, the compliance piece, the oversight of the sub-grant process, we don't distinguish between federal or state funding.
all
It's,
tax money?
it's all state tax money. We had been working really hard getting our state funding accountability in place very early, just, you know, to really for our financial survival, we had to get our
Yeah.
financial house in better
Right.
shape. So that's been a lot of attention there, but, you know, really the last 18 months, you know, heavy focus on the federal compliance side. What's really frustrating is the feds were totally fine. You know, we were in compliance on the federal side, but I was not happy, state auditor was not happy, and you're not happy. You know, then that required, you know, the changes to be in place, which also required a lot of personnel changes.
Also, I would also have to bring up the sex education grants that were coming through the health department when the HHS letter came down. And of course, that was something long before you got there as well. But, you know, they were going so far as to be in violation of state law, not just the federal guidelines that came in during the Trump administration, but they were not doing what was compliant with state law.
That is in full compliance now.
Yeah, and so I wanted to mention that was also straightened out, and that's also because of, you know, nobody was monitoring them, and that'd been going on for years and years and years. So, you know, we are looking at it, and when it's brought to our attention, we're gonna fix it. You and I and all the rest of us are gonna try to fix it once it's brought to our attention. Bureaucracy is big, and it takes a lot of eyes, but I'm happy to see that we've moved in the right direction with all that.
I'd like to point out quickly, I also brag on y'all supplying us with the 2.9 million of public health program support, which y'all started doing 2 sessions ago, which has been a game changer for us. And this coming year, one thing I plan to do in terms of fighting obesity, which is really our largest public health challenge for the state of Mississippi, is adding obesity management as a core public health clinical service in the county health departments and using some of that funding to support the expansion of clinical operations in the county health departments, as well as we continue building the OB system of care. We're using that funding for that. Our maternal infant health, especially our home visitation program for our high-risk moms and babies, that funding goes there. So that funding has been a game changer, just asking for it to stay as is. And then outside of our appropriation, we are asking for seed money for the Public Health Trust of, it would, based off the net revenue from the cannabis program. Y'all know we have about 80% responsibility for regulating cannabis program, but you also need to know it became profitable last year for the state of Mississippi. The program generated about 9 million of net revenue for the state last year. This year, it's about 12.5 million net revenue and growing. I anticipate that the program will generate net revenue for the state probably in the range of 40 to 50 million a year once it grows and matures. By seeding the trust the way we're asking this year for a short period of time, that will allow me the ability to get private sector money into the trust that we desperately need to support public health programs in perpetuity. So mainly just pointing to the fact that the cannabis program is profitable, and if y'all could help us get the trust jump-started financially, that would be a huge help to our work.
Do you happen to know how much you've collected on violations?
I do. I want to, the year before last, I think we're probably around 200,000 on the health department side total since we began.
How many licenses have you revoked?
Oh, we've revoked several certifying providers who were non-compliant. We revoked a lab license. We've revoked a few cultivators. We, our compliance is quite robust, and we have learned what industry will respond to. Fines are not a big deal because they're capped, but when you destroy plants and product that are illegal or out of compliance, that changes behavior quickly. I couldn't possibly take the amount of value that has been forfeited in the last 3 years. I mean, it's in the millions.
So once that
Correct.
happens and you have to go that far to destroy the plants and that level of noncompliance, you do revoke the license, or do they get another chance at it, or?
It depends on what the violation is. If we believe, if there's any evidence of diversion, that's revocation. If it's repeated violations below that, then we'll oftentimes do suspension and plant destruction. We always destroy what we consider in any unaccounted for plant. If it's not in the system and we find it's destroyed, that's illegal plant.
Yeah.
So we have a kind of a graduated disciplinary tract for industry.
And the fact that law enforcement was basically written out of that bill and it was basically left to you, how much interaction have y'all had to bring in law enforcement?
We're really grateful that y'all brought revenue in, because Department of Revenue are our guns and badges for the cannabis program. When we see illegal activity, they're the ones who come with us. And then we call MBN anytime we're concerned about diversion or any illegal activity. And anytime we have serious violations, if we believe it's in violation of state law, we refer to the Attorney General, and any unprofessional conduct is referred to the appropriate licensure boards. And we've made many, many referrals.
Well, we keep seeing these clinics, with these days to come advertising, come get your license on the spot and all that. Something's not deterring that, because we keep seeing that over and over. And that's what I keep sending you, and I'm not looking. I'm not looking at all. I'm too busy. And when I'm seeing it, it's happening a lot. So, they're not going through the proper channels that the statute said that they're supposed to do to get people certified. And they don't care. They obviously don't care.
We're complaint driven. So every time, we're notified, we investigate, and usually they are out of compliance, and they have disciplinary action imposed. If they are repeat offenders, then they're excluded from the program. And we've excluded several of those situations out of the program. But the program continues to grow. We're more than 66,000 patients. That's almost 20,000 more than last year. And even though you're seeing some contraction of industry participants, because it's a full free market system as y'all set it up, and the market is dictating things, what we are seeing is a growth in workforce, which I think, we all would be pleased with. The number of number of Mississippians being employed within the industry has grown significantly.
Well, one of the sad things that I can comment, I've been driving on the interstate for 15 years, coming back and forth to Jackson, and I've only recently started smelling marijuana coming out of 18-wheelers in just about every car that I pass on the interstate. So we have a problem with that. And I don't know how we're going to address it yet, but that's becoming a bigger problem. I'm getting a lot of complaints from residents about, passing cars, passing 18-wheelers, and I mean, your car smells like pot when you get anywhere close to them. So I think we're going to have to look at something, because when people think it's legal and it's, okay to do it, they're doing it everywhere, because they know now that smell is not a probable cause. And I think we're having a lot of 18-wheeler accidents and things too that I think maybe contributed to some of that, but we'll address that later. But I thank you for what you're doing and trying to, keep them in line and monitoring everything that you're doing. And we'll just have to keep plugging away at, the things that we're trying to do with, reducing the mortality rates of certain demographic areas, and just better health overall for Mississippi.
Let me share with you, we're showing a return on the great investment that the state has entrusted with us the last 3 years. I am so excited that from where we began being well below 50th. If there had been anybody else in between us, would have been lower.
Same with reading.
That we started so far behind the pack that we have closed that gap. And for 2 more years in a row, we've moved from 49th to this year, moving to 48th in overall health outcomes. That is a significant economic developer for the state of Mississippi. That is reducing that $25 billion a year negative impact to our economy by improving the health. And that does not happen organically. You know, we're not up in education just because it happened. It's because y'all made the investments and made the right policy changes. We're doing it in health, and we're starting to see that movement, which will be very profitable for the state of Mississippi, but most importantly, improving the lives of our citizens. So, I mean, we are seeing improvement.
I'm just wondering how much these GLP-1 drugs are driving that, you know.
They're a game changer.
Would anybody have a question for Dr. Edney? Senator DeBar?
Thank you, Madam Chair. Thank you, Dr. Edney.
Yes, sir.
Appreciate your presentation. I was noticing in the LBO notes that you brought back about 350 nurses and public health specialists at about $25 million. Where do those people work at? Are they scattered throughout the state and local health departments, or where do you?
Our public health nurses mainly are in our public health clinics, in the level 2s and level 3s, but we also had public health nurses in the Healthy Moms, Healthy Babies program that we're scaling that back and converting that into a community health worker visitation model. We do have nurses that are also doing healthcare inspections with the hospitals and nursing homes.
Are they? Okay.
So we have a fairly large nursing workforce.
Well, nothing wrong with that. I was looking at your budget requests, and you said you you're just requesting LBR, but according to your documents, it says that the general fund request is a $5 million increase from last year. Do you know why that is?
No, sir, our request was level funding from last year for our state general funds.
If you look at this document, it says your general state appropriations request from last year is 60,633,000. This year it's 65,936.
Then and when I talk about level funding, I'm talking about
Okay.
1 and 2.
What's the,
Appropriations
okay,
also includes pass-throughs and also includes
okay.
trauma fund.
What's the $5 million increase? Do you recall?
Frida?
Can you come up? I can't hear you. I'm sorry.
Ms. Tribune is our CFO.
Okay, no problem. And what's your name? Thank you.
That was, that was the, and so it's now between capital expenses.
And that's to pay for what again? I can't hear you, not speaking into the mic.
That was given to us previously, the capital, out of the capital expense funds. So instead of requesting budget of funds, we're requesting that to be general funds, capital expense funds. Last year, for several.
Okay. Yeah, CapEx is usually one-time record, but now this is a recurring request, I guess. So I guess continue.
More of a reappropriation.
Yeah,
Yes, sir. just
okay.
to give us more time to utilize it.
Okay.
Not an increase of general fund expenditure to us. The agency funding is staying stable at around 60 million.
Yeah, right. You're asking for a general fund increase, but that's to divert it from CapEx, but overall you're level. I understand what you're saying. Okay. All right. Thank you, Madam Chair.
Also wanted to ask you about the rural water match.
Yes, yes, ma'am. That number is always given to us, calculated to determine what would be maximum drawdown from the federal funding. And we always supply y'all what that maximum match number is, and then defer to y'all how much you want to fund the SRF program from that. I do think if we don't do the full match, I think That eliminates some of our ability to forgive some of the loan balances, but we still, would adequately fund SRF. So we give y'all the number for what the maximum drawdown would be.
Corbin?
I think it's the same. They should come up here, Lucretia, just stay.
Mhm.
It's about, it's the same as last year, I believe, a little over 8 million.
So that was rolled into LBR.
Yes, ma'am. We give that number, and normally weighs in, on the Senate, the Finance Committee
Yeah.
deals with that, because again, that's pass-through money. We don't consider that an agency support, but it's about 8 million a year.
On your ARPA funds, will you expend those by the deadline?
The water, that,
Yeah, by September.
yes, ma'am. It's a total of about 400 million. And, I keep asking, I keep pushing, and, everyone is telling me that we're on track to have the spend completed on time. And we're tracking that closely.
Talking about the water match.
The rural water matches with the state revolving loan fund.
Corbin?
So y'all had the rural water program, you'll had the health infrastructure program, you'll had the local provider infrastructure program.
Hospital.
Y'all had,
program.
Right.
ICU, there's a number.
Yeah, those,
Just wanted to.
the only-
know if it changed.
no, the only thing that's still active is the water program, and that's still a lot of money.
Is it because some of them are having trouble with the match, or do you?
No, ma'am. It's just, those water projects it takes a lot longer. Initially, there were supply chain problems and a limited number of water drillers. So the spend is escalating. They've gotten past the initial hurdles. And I'm being assured that, that the money will spend down in a compliant fashion on time.
If we need to call any of these engineers, let us know.
Okay.
We want the money spent.
And we do as well. And like, we know some of the the innovation money is not going to be spent, and we're telling y'all to pull that back. It's only like 4 million. Everything else has been spent down.
Okay,
Back,
Yeah.
like, as of whenever.
And we're
Yeah.
staying in touch with them like, we're closing out the innovation program, but water's still going.
and can you speak a little bit about moving the child care licensing to DHS?
Yes, ma'am. That's one of those things as a new agency head 3.5 years ago. The more I learned, the less it made sense to me, because everything at the federal level with child care is with Human Services, but at the state level, it's been with us for over 20 years. And we have to work with Department of Human Services to operate, because all the federal funds come to them, but we have the licensure and regulatory component. So for the last 2 years, we've been working with DHS about what makes more sense to run childcare efficiently and effectively. And to me, it just didn't make sense to have two agencies to operate one program.
Because
So
they're doing the grants.
they're doing all the grants. We have to consult with them on all the federal regulatory changes. And, I love childcare. Childcare is extremely important, but it's really child welfare, more than public health. And so it made more sense to me, that it be at DHS. I think it would be more cost effective for it to be at DHS. They definitely have the expertise, and Bob Anderson and I have kind of worked through this. So this is kind of a joint effort to get childcare where we think it needs to be, if y'all agree.
Can you speak a little bit on the opioid settlement status?
So the opioid abatement committee made its recommendations to the legislature. I served on that committee. That was a lot of work. It'll be easier if y'all have us do it again. We've learned how we need to do it and what we need to do, what we don't need to do. We didn't have much time to get those recommendations done, but I feel fairly confident that the tier 1 and tier 2 program recommendations are solid, and there's enough funding to fully fund tier 1 and tier 2. When you get down to 3 and 4, then, those are good projects, but, less impactful than the first two tiers. So y'all have a recommendation coming, that was sent through the Attorney General's office on 5 tiers and kind of our scoring and our thoughts on that, with recommendation, to consider fully funding tiers 1 and 2.
So who's going to provide the oversight on that, on those grants? Like we were discussing, the ones that y'all have gotten under control with this new system. Is that going to be, can we roll those into that new system? Because we need to keep an eye on that money, just like we need to keep an eye on any of the rest of the money.
Oh, Lord,
How-
Senator, that means you're sending it to me.
No, I'm not saying I'm sending it to you. I'm asking what we need to do to track that money so that we don't come back with the same stories that we had on some of these other sub-grants. I'm trying to get ahead of the game. Because when that money's out there and you sub-grant it to nonprofits, if nobody's minding the store, we don't know what's gonna happen.
My understanding, the Attorney General's office is over the compliance for those sub-grants.
Okay, well, maybe y'all need to talk and you need to tell them what you've done to, 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 for compliance and transparency on these other grants, and maybe they could adopt something like that too, because, I mean, it's our concern as lawmakers, because we're the ones get the blowback. Well, y'all not watching, they're wasting taxpayers' money. And like I said, bureaucracy's big. It's hard to keep eyes on everything. So I think we need, and I'll speak to the Attorney General's office too, I think we need a clear way of having accountability on those grants as well, because we don't want to come back with similar stories. That's the first thing I thought of when I saw all that, all that recommendation for that, from that committee. Not saying that anybody's going to do it, but we want to make sure that there's no room to do it. And one more thing, after Tuesday, after the general bill deadline, if y'all could just survey any of the bills that you think might affect you and how they might affect you, and just get back to
We surely will.
Corbin about it, so that we can kind of flush that out before floor action.
Yes, ma'am. Very happy to.
Would anybody else have a question for Dr. Edney? Well, we appreciate it.
Thank you.
Keep doing what you're doing.
Well, and thank y'all for your support. Very grateful.
And this committee will come back at 1:30 for pharmacy, then 2 o'clock chiropractic examiners, 2:15 PT, and 2:30 medical licensure. And I know some of y'all may have other meetings that take precedent. So, I was just going to remind y'all.